Defibrotide has been around for many, many years, and it is the only drug that's currently FDA approved for the treatment of transplant-associated hepatic veno-occlusive disease, which is a condition that also involves endothelial damage in the sinusoidal and the central veins of the liver. Because defibrotide has broad anti-inflammatory as well as anti-thrombotic activity and is specific to the microendothelial vasculature, there's been great interest in exploring this drug for the use in TMA. The defibrotide has been used for many years and more often used in Europe for TMA. There's now at least 16 publications in the literature looking at this drug in patients with TMA. Although these are all small case series that ranges from 1 to 60-something patients, they all tend to show a response rate, and the response rate's probably somewhere in the round of 60 to 70%. Although it's hard to compare the literature because every paper has its own different criteria for response. Nonetheless, the drug is fairly safe and based on its properties, appears to be encouraging in this disease, although there's no FDA label for its use in this condition. At the ASH meeting this year, Jeff Lawrence presented a poster abstract where they assessed the protective effect of defibrotide on the microvascular endothelium. In this study, they took plasma samples from many patients with different types of TMA, included the TTP, HUS, as well as transplant-associated TMA. And they used this plasma from these patients and exposed them to the endothelial cells, showing that the plasma from these patients exert a damaging effect on the endothelium because they have TMA. And when they co-incubated the plasma with defibrotide in these patients, they were able to show that defibrotide reduced the apoptosis of the endothelial cells in the presence of this plasma, especially from patients with TTP and HUS, and also some patients with transplant-associated TMA. They measured the endothelial apoptosis by measuring the activation of caspase-8. And in many of these patients, there was at least a 20% decrease in caspase-8 activity when defibrotide was introduced. So the overall conclusion from the abstract was that in these TMA processes where there are agents in the plasma that damage the endothelial cells, defibrotide will protect the endothelium from apoptosis. As I mentioned, defibrotide is currently FDA approved only for the use as treatment for patients with hepatic veno-occlusive disease and sinusoidal obstruction. It is not FDA approved for use in defibrotide, but it's being used as off-label in certain cases. I have not personally used it at our center for TMA, but I'm aware there are currently, there's at least one clinical trial that is using it in the prophylaxis setting. In fact, defibrotide may be most effective as a prophylaxis in this setting because it works by just protecting the endothelium from early insult from the immune prophylaxis as well as from the conditioning regimen. Certainly more studies are needed to confirm the efficacy of this drug in the treatment and prevention of TMA. Although we do have a number of papers that have been published suggesting efficacy, those are all case series and not prospective clinical trials. And so I do believe that a prospective clinical trial would be important, and defibrotide, if effective, could have a role in the treatment of this disease, especially in combination with complement blockade to protect the vascular endothelium.